Hi, I'm Amanda Olson from IntimateRose.com, and I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. And today I'm going to talk about how to use the Intimate Rose Kegel exercise weights to address fecal incontinence. So many women experience fecal incontinence. So if you're experiencing that, you are not alone. And that type of incontinence can include loss of stool accidentally or loss of gas. So if you're experiencing accidental gas leakage and or loss of stool in your underwear, you're not alone, and it is a fixable problem. In addition to seeing a pelvic floor physical therapist, you can use Kegel exercise weights to strengthen the pelvic floor to address those problems. So a little overlook on anatomy. This is the pelvis. The bony structure is in white, and the red structures here are musculature. So what you can see is we have the urethra, the vagina, and the rectum back here. Those three structures line up here, and then looking at the top view, we have the bladder in front, the uterus and the vaginal canal behind that, and then the rectum behind that. So you can see that the rectum is a close neighbor to the uterus, if you still have one, and the bladder as well, and they are all three supported by the pelvic floor muscles. I'm going to take these organs out now so you can see the deep layer. Everything that you see in red here, coming off of the tailbone, coming out through the sides, and coming forward, is pelvic floor musculature. When you experience fecal incontinence, looking at it from the superficial angle here, you are experiencing issues with the back or the posterior part of the pelvic floor muscles. You may also be experiencing weakness in through the front with urinary leakage as well, or maybe in through the center around the vagina with some pelvic organ prolapse. But specifically speaking about fecal incontinence, we want to talk about strengthening the muscles of the back and also equally strengthening the pelvic floor muscles as a whole. And you can do so by doing Kegels. At the end of the day, a Kegel is simply a contraction of the pelvic floor muscles. And by doing those repetitively, you can strengthen the pelvic floor muscles. There's some evidence suggesting that 60 to 80 Kegels are required to stop incontinence. And so you can see that's a very high volume of doing Kegel exercises. By adding resistance to the pelvic floor by using a Kegel exercise weight, you can strengthen the muscles more progressively or a little bit faster. The Kegel exercise weights do go into the vagina just like a tampon, and you can see here white is the lightest, and as the color purple gets darker, the weights get heavier, so they come as a set to allow you to get stronger. The weight does go in through the vaginal opening, which as you can see here is the midpoint of the pelvic floor, with the anus being behind and the urethra being in front. So you are working on strengthening the pelvic floor through the midpoint. But just because the weight goes into the vagina doesn't mean that the back fibers around the anus are not getting strong as well. So you can put the Kegel exercise weight into the vagina and do active Kegels with it, focusing on squeezing around the anus here and holding for 5 seconds, and then relax. And you can do 3 sets of 15 of those, either in the seated position or standing, to actively engage those pelvic floor muscles with resistance so that you can get better closure to stop that leakage around the anus. Another thing that you can do is put the weight in and take a shower or do the dishes or do something of moderate physical activity with the weight in. During that time, the pelvic floor is engaged, and the pelvic floor muscles have to be challenged by those physical activity motions in order to get stronger. And in doing so, the back part of the fibers will get stronger as well. So there's a couple of different ways that you can go about it. For more information, you can visit our website at IntimateRose.com, or you can email support@IntimateRose.com.